today, I received a call from our colleague, Patrick Kennedy, about the news of his father's health. That news has been met throughout the country with great concern. I have confidence, though, because Senator Kennedy has been a fighter all his life. He is a fighter for our children, for our workers, for our seniors. He is a champion fighting for health care for all Americans. I know that that fighting spirit will hold him in good stead in the challenge that he faces now. I know I speak for all of my colleagues when I say that our prayers and thoughts and good wishes are with Senator Kennedy, with his wife Vicki, with our colleague Patrick, his son, and with the entire Kennedy family.
That was House Speaker Nancy Pelosi, obviously talking about she had heard from Patrick Kennedy, a congressman from Rhode Island, the son of Senator Ted Kennedy. We've just learned here in the last hour or so that Ted Kennedy has a brain tumor. That news coming to us from Massachusetts General Hospital, where he has been since Saturday when he suffered a seizure, the first sign that something was the matter there. And of course, even though Ted Kennedy is a Democrat, really a liberal icon, news of his illness is reverberating across the U.S., across Washington, with both Democrats and Republicans.
And we're confident he's going to be back here. So we wish he and Vicki and the family well.
Well, Ted Kennedy and the Kennedy family have faced adversity more times, in more instances, with more courage and more determination and more grace than most families ever have to face such a situation once. And every one of us knows what a big heart this fellow has. He's helped millions and millions of people in so many ways at so many different times. From the biggest of the legislation on the floor to the most personal, when he would call you and help arrange a discussion with a bunch of doctors to talk about a wife who was sick or a child or any number of things. Now everybody needs to do that on behalf of Ted. Everybody needs to pull for him and his family. And remember that this guy is one unbelievable fighter. Over the weekend, I saw him. He's in a fighting mood. He is asking questions about what the choices are for him. He's deeply involved in making all the kinds of personal decisions that any of you would. And I think one of the most important things here for all of us to try to do is remember that even as this man, who is a living legend, who represents so much of our history, is going through this, we all need to try to give the family privacy. We really need to try to do that. And we need to recognize and respect the unbelievable tower of strength that he draws from Vicki, from each of his children who've been with him over the weekend, from his unbelievably loving and caring family. And that family is a big extended family of Americans and of people all over the world. So we're pulling for our pal. And I know that he is determined to fight this because he wants to continue to fight for the people of Massachusetts, and he wants to continue to fight for the things he believes here in the United States Senate and in the country. Thank you.
We'll leave questions to another time.
All right, well, Dr. Wendy Wright specializes in neurology and neurosurgery at Emory University Hospital right here in Atlanta, and she joins us now here. And let's just be honest about this, doctor. It is the most malignant brain tumor there is.
This is not the news that the family or any friends of Ted Kennedy wanted to hear. We're all very concerned in the medical community about this as well.
All right, also, the cold hard facts here, the prognosis as far as what's the survival rate when it comes to this type of brain tumor?
Right. Well, malignant glioma actually spans a couple of different types of brain tumors. Glioma just means a tumor of the brain tissue. It doesn't spread outside of the brain or skull. Malignant is the part that you don't want to hear. It means that it's fast growing and not generally curable with standard measures. We try to control the tumor as best as possible. Here we see a picture of the brain, and from what we're hearing, the senator's tumor is in the parietal lobe, which has some very important functions, especially on the left side. It can control movement on the right side of the body, and actually can control some speech functions.
But
Prognosis-wise, I know that's what you want to hear.
Yeah.
Depending on which brain cells are involved, the prognosis can range anywhere from a couple years, but unfortunately, more commonly all the way down to 6 to 8 months.
6 to 8 months,
Right,
okay,
right.
a couple of years. But with extended and aggressive treatment.
Extended and aggressive treatment can provide a little bit of prolongation from that, and fortunately for the senator, he is being cared for in one of the best hospitals on the planet, so he's certainly got that going for him, and we wish the best for him.
Yeah. So we've got this model here, and
Right.
we're talking about the left parietal lobe. And you said that the concern about that is because you don't want to make it worse.
Right.
Make
I mean,
things worse.
common treatment options are going to include surgery where you can resect out part of the brain tumor. The problem with glioma is when the surgeons go in there and try to work on this, it's nearly impossible to tell what is tumor and what is actual regular brain cells, because this is a tumor of the brain cells. So oftentimes you can't tell by looking what is actually tumor and what's normal. So the patients can actually have more damage caused by the surgery than they can by the cure. You don't want that to happen. So oftentimes chemotherapy or radiation are offered as a choice along with surgery, or instead of surgery if his surgeons feel like it's going to be too dangerous.
So would it be common to perform surgery right away?
It's common that surgery is offered very, very early in the treatment course. As long as the person is not too sick to undergo surgery, that is a pretty common.
Okay. I asked this of Dr. Sanjay Gupta just a little bit ago. Obviously, this is sort of hypothetical because he's not your patient.
Right.
You haven't seen his chart. You don't
Right.
know all of the history here. But if you were Ted Kennedy's doctor and just hearing what you heard, what would be next for him? Would it be surgery? How would you treat him? How would you go about this?
It's the deciding factor is if the tumor is in an area of brain, and left parietal lobe is really what we call high-risk real estate. It's just near a lot of centers that can affect the ability to move the right side of the body, and possibly also the ability to speak and understand. For someone who's so high-functioning as the senator is, a little bit of damage there is going to go a long way and really affect who he is and what type of quality of life he has, and so it's difficult to tell. Surgery, again, might just be too dangerous for him. It might really affect the time that he has and the quality of life that he has left.
Dr. Wendy Wright, thank you very much for joining us from Emory University, and she specializes in neurology and neurosurgery, giving us really the facts and the basics when it comes to this type of brain tumor. As she said, sadly, usually a 6 to 8 month prognosis, but treated aggressively, it could be a couple of years. Those are the facts. Those are the facts here, and we hate saying that. We hope he's okay. We hate to say that. We have much, much more to come here in the CNN newsroom, including a reaction from Washington on how this
and Wolf Blitzer standing by for us. He interviewed Barack Obama. What did he say, Wolf?
Brianna, we spoke only a few moments ago, and among other things, we spoke about Senator Ted Kennedy, who, as you point out, is one of the key supporters of Barack Obama's search for the presidency. And I asked him for his reaction, and he spoke emotionally about the Massachusetts senator.
Well, it's heartbreaking. I had just spoken to Ted 2 days ago, right after the seizure, and he seemed in great spirits. He sounded terrific. I think the family was feeling more optimistic. Obviously, we're all shattered by the news today. But you know what? Ted Kennedy is a fighter. The reason he is the giant of the Senate, the reason that he's accomplished more than any of the others who were there, the reason that he has been able to help deliver voting rights and immigration rights and helped people who are vulnerable is because he fights. He fights for what he thinks is right, and we want to make sure that he's fighting this illness, and it's our job now to support him in the way that he's supported us for so many years. He's not just a great senator, he is a great friend. He is beloved by me and beloved by my colleagues, and so we're going to do everything we can to support his family during this difficult time, and my thoughts and prayers are going to be with him.
Give us a final thought, Senator, on what Senator Kennedy means to you.
Well, you know, keep in mind that I think you can argue I would not be sitting here as a presidential candidate had it not been for some of the battles that Ted Kennedy has fought. So not only is he a personal friend, not only has he been one of my most important supporters during the course of this campaign, but he's somebody who battled for voting rights and civil rights when I was a child. I stand on his shoulders. And the fact that he's also a great friend, somebody who always has a kind word to say, always has good humor, even with his adversaries. He's been, I think, a great model of what a senator can and should be. And I expect that he's going to fight as hard as he can to make sure that he's dealing with this illness.